In this module, we will cover health records management and technology. After completing this module, the reader will be able to identify major health information management department functions, list the key components of a patient's health record, differentiate between confidential and non-confidential information, and privacy and security requirements in a radiologic setting, and finally, identify the types and needs for an informed consent. We will cover the following aspects of health records management and technology: health information management, HIPAA, HIPAA security, incident reporting, informed consent, types of consent. So let's start with health information management. Every healthcare institution needs a health information management department that has been organized to provide adequate record management systems and practices. Health information departments function to maintain the health information and medical records of all patients entering the facility and to provide private storage and easy retrieval of the records by patient name or number, physician name or number, diagnoses, procedure, and other subject items deemed necessary. Regardless of how the records are stored, they must ensure patient privacy and security. Health records serve to support the current and continuing care of patients. Health records are also necessary for patients' billing and accounting, and to support medical education programs or health services research. Records are also used for risk management and quality management, or as a source of implementing improvement programs. Within a hospital or medical care setting, radiology records are usually differentiated from general hospital records. A hospital information system, or HIS, is a comprehensive, integrated information system designed to manage all the aspects of a hospital's operation, such as medical, administrative, financial, and legal issues, and the corresponding processing of services. A radiology information system, or RIS, is a computerized database used by radiology departments to store, manipulate, and distribute patient radiologic data and images. The system generally consists of patient tracking and scheduling, result reporting, and image tracking capabilities. RIS complements HIS and is critical to efficient workflow to radiology practices. Some facilities have a third system, electronic medical records, or EMR, or an electronic health record, or EHR, is the digital version of a paper chart in a clinician's office. It contains the medical and treatment history of the patients in one's practice. HL7, or Health Level 7, is the software standard for exchanging electronic text information between departments and institutions in a compatible format. HL7 provides standards of interoperability between the different systems. The HL7 system is needed because the Radiology Information System handles mainly textual patient records, while the Health Information Systems, or Hospital Information Systems, contains reports as well as images. HL7 is compatible with both. Before a radiologic procedure is performed, a radiology order or a request for service should be completed. A diagnosis or signs or symptoms for which the test is being performed must accompany each request. The result of the procedure is also documented. This information is stored in the radiology records. In fact, any special reports documenting evaluation or treatment of a patient must be stored as part of the patient's permanent record. Without the requisite documentation in the health record of what was done to the patient, the assumption is that the event did not take place. Medical records can contain sufficient information to support the diagnosis for reimbursement purposes under the Diagnosis Related Group, DRG, and the Prospective Payment System, PPS, implemented by the government in 1983. All diagnostic and therapeutic procedures are categorized by the ICD-10-CM. This is the International Classification of Diseases, 10th edition, clinical modification. It allocates specific codes for all diagnostic and therapeutic procedures and are used to reimburse physicians and healthcare facilities accordingly. There are also specific codes for outpatient and inpatient settings. The DRG categorizes patients into payment groups with respect to diagnosis and treatment and arranges them in statistically similar branches with regard to the length of the stay. The PPS system is used for Medicare hospital inpatients, whereby patient groups are established in advance. Hospitals get paid up front regardless of how long the patient stays at the facility. A process that monitors and evaluates the quality of care and services provided to patients within a healthcare facility is known as quality assurance or quality assessment. Medical records can be used to assess any quality assessment in different areas of a facility, including utilization, risk management, infection control, surgical case review, medication usage, health record review, blood usage review, pharmacy and therapeutic review, case management, hospital and department committees, and finally, radiation safety. Health records are considered legal documents. A technologist could be required to give depositions or a testimony regarding information in the health record, or, in the case of a radiograph, a testimony regarding the procedures involved. The proper method for correcting an error in a paper record is for the author to draw a single line through the error, write error, and then record the correct information. The individual should then date and authenticate the entry. Digital records cannot be deleted. The correction is entered with sufficient notes to indicate that it is a correction for a previous entry. When registering records, write legibly and in ink. Use correct spelling and standard abbreviations. Document accurate information in precise and correct terms. Keep information concise and begin each entry with the date and the time of the entry. Use military time to avoid any confusion. Information should be recorded in the order of occurrence. After documenting the entry, include your initial or signature and title and date. Remember that all medical records are confidential. If writing records, do not use a pencil, block out, or erase or leave blank spaces. In electronic documentation, do not enter unnecessary details or assumptions. Do not include disparaging comments about the patient or other healthcare professionals. Use standard abbreviations only. Do not incorporate hearsay reports or divulge private information concerning the patient. Health records are considered confidential. Informing patients of exam results is the physician's responsibility. If patients request their records, the technologist should refer the patient to their physician. Although the caregiver or the facility own the records, the patient has the right to the information included in the report, except when prohibited by law or by the patient's medical condition. Digital records must be maintained in a secure area with limited public access. Backing up copies of digital records is recommended. Any backup record should be done without affecting interpretation quality. Backup copies of patient records and images should also be stored off-site if it is economically feasible and security is maintained. This will avoid a total loss of records in a case of a disaster. The Joint Commission, TJC, is an organization that accredits healthcare organizations. Their position statement declares that a medical record must contain sufficient information to identify the patient, support the diagnosis, justify the treatment, document the course and results, and promote the continuity of care among healthcare providers. Medical records must contain information to justify the admission and continued hospitalization, support the diagnosis, and describe the patient's progress and response to the medication and services. The patient's medical records should document the following: patient ID and demographics, medical history, conclusion and impression on admission, diagnostic and therapeutic orders, clinical observations, report of relevant physical exam, consultation reports, diagnostic and therapeutic reports, final diagnosis and prognosis, discharge summary, postmortem results, physiological needs summary, physical exam report, psychological needs summary, treatment plan, evidence of informed consent, progress notes, reports of surgical and invasive procedures, records of donations and implants, conclusions at termination of stay, and discharge information given to the patient and family. All hospital or healthcare facilities must maintain records. Charting of patient information is the responsibility of everyone in the department. Documenting in the patient's record or charting should be done by radiologists and radiographers when a patient receives either diagnostic or therapeutic radiologic services. Most medical recording is now standardized. Electronic mandatory field should be presented depending on the facility or testing. General information that must be provided include patient identification data, medical history of the patient, including the chief complaint, present illness or injury, relevant family or social histories, and an inventory by body system. Report of relevant physical exam, diagnostic and therapeutic orders, clinical observations including results of therapy, reports of diagnostic and therapeutic procedures and tests, as well as their results, evidence of appropriate informed consent. When consent is not obtainable, the reason should be entered in the record, and conclusions at termination of hospitalization or evaluation of treatment, including any pertinent instructions for follow-up care.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.